I wanted to take a few minutes to talk about differences between narrative and conventional medicine. Um, so, in my own personal experience, a lot of people don't know, but I've shared my experience with many that I went through chemotherapy in 2014. Yes, the entire year. So, during my treatment, there were some practices or techniques that they were using to help me get through the chemotherapy that I thought were probably a little bit of integrative health approach of using a community approach to the medicine, which I greatly appreciated and later found out that after I left the hospital that they started using Reiki techniques and different not aromatherapy because that would have definitely made a cancer patient nauseous. But they did approach it from a way of caretaking, of having someone there always to accompany you, especially if you didn't have friends or family to come in to visit you during your treatment time. And because you're halfway out of it and you're not really cognizant of what's going on, you're the moments that you are awake and around, the only people you get to talk to is are the nurses. So in the nurses stations, with whom I got to know very well, occasionally um, they had options where you could get different visits from the chaplain, social services, as well as they did have a comfort pet, and you get a choice if it was a small or if it was a medium-sized dog. And I got a chance to have them in my room, and they were already trained on how to deal with or be in the room with a immunocompromised uh, patient. So that really helped because in conventional setting, it's really you're in a state of isolation. In my case, one of the like really heart tugging things questions nurses didn't even know that offended me during the time was that do you have anybody who care for you? Do you have anyone who will pick you up from the hospital? At the time, the question was no, no girlfriend or anything like that, not married or anything. So uh, my community that helped me through my whole treatment phase was really extended family, friends, military community. They would pick me up from from the hospital when or take me to the hospital rather, it'd be my transportation to and from home when I had to go through treatments with that would make me feel nauseous and sleepy. So that form and folks who would check up on me from time to time. So that was my community. So I did have a bit of an extended community to help me, and I think that is very important for all those who are in the hospital, especially under conventional care, which I always attack from time to time is saying that Western medicine is broken down into three things: pharmacology, which is chemo, radiation, or surgery. And I've experienced all three. So I can tell you from those approaches, when you have the you're the centerpiece of attention and you have 12 doctors who you know nothing about because you've never seen them during your time there, and they're just observing you, you feel like a mantelpiece or some kind of zoo animal, which makes you feel even more isolated. And they don't have anything in place to really deal with depression or any mental anxieties or any conditions that might the medication might be causing you to actually become depressed, and you may form into a chemo depression or the anxieties you have from not knowing what's going on because you get tons of literature. Now, fortunately for me, my background was in uh, graduated George Mason with biology, so I could talk to the nurses and understand the medical terminology quite well without having to have too much interpretation. And I had my laptop with me, so I was able to actually get more information from my doctor who was there and present, and would ask me, and we would actually have conversations. So some of the narrative that I think doctors have lost. Most of the nurses still have is they have so many patients to see that they've lost touch with their patients as far as knowing that that mental component is a high on my bar component of healing. It is definitely that conversation and definitely that community together that puts you together. Now, for me, I had my family and friends that gave me 10, 10-point systems. I had all kind of alternative care things thrown at me to the point that I got a headache from listening to it because I was actually in the care of conventional medicine, and I could not intertwine at the time my treatment with things that you find on the internet. You have folks who were not herbalists, but were giving you all kind of herbs that they saw were it decreased cancer cells and things of that nature. And I'm like, okay, too much, too much, too much. Okay, my insurance don't pay for that, is the kind of approach I had. So because it became too much with all these suggestions from everybody who was an expert while you're going through it, instead of those who came by, I really appreciated and actually sat down and had a conversation with me when I was coherent and not foggy. So what I believe that narrative medicine